Insights from the world's best medical minds. You are watching therightdoctors.com.
Hi, I'm Dr. Abhay Nene. I'm a spine surgeon practicing in the city of Bombay, and I'm into tertiary care spine services in one of the most popular cities in the world. I'm on this platform, therightdoctors.com, and this is clearly India's leading medical knowledge platform, and it's doing great service in terms of connecting medical professionals with the population in general, and connecting medical professionals with each other. So I'm very, very proud to be on this show. I'm here to talk to you about how our new lifestyle today has affected our lives from the lens of a spine surgeon, which means pertaining only to your spine. So it's a selfish view, only looking down your spine. I'd like to first discuss how and why staying at home has actually increased the incidence of back and neck pains, the causes and the effects, and the treatment. And I'd also like to touch upon how the services for treating this back pain have been affected or have changed in the light of the new restrictions of in what we call quarantines. Now, when you look at this from the lens of a spine surgeon, it's literally not a lens, it's a kaleidoscope. There's so much that has changed. There's so many factors that have come in that it's not so streamlined or algorithmic to put this down in a chart. So there'll be bits and pieces of information that we'll be catching on and discussing. So let's go about figuring out how the effects of the lockdown have affected your life and have affected my life through my lens. So there have been some major lifestyle changes that we have undergone during this lockdown. Clearly, I think the bottom line is that most of us are sitting at home. That may be sitting at home in parenthesis, but the fact is that we have been working far less or stepping out of the house far less than we were used to. So our productivity may not have decreased in some walks of life, but clearly the way we are approaching our work has changed. What I'm coming to, or what I'm really pointing at, is the number of sitting hours that have exponentially increased in this work from home situation. So most of us have been sitting on our sofas, working off our laptops or our desktops most of the day, and the ones of us who are more productive spend much longer hours sitting. Now, with sitting becoming this default position, and all the other movements of getting out, catching a lift, getting into the car, driving to work, walking around, walking from one place to another to meet people, etc. All the stuff that happens in the background, which we are typically not even aware of. After that has got cut down with the number of increasing sitting hours, there's a direct assault on your lower back. Now, you must understand this, and I'm going to try and explain this to you as well as I can. That your back is not a single rod. It's a, as multiple small bones which are cushioned in between by what we call discs, which are actually like foam pieces. And these foam pieces have a shape memory. This shape memory resists deformation. So when you load up the spine doesn't want to change its shape, and that's how your back remains upright and erect as it's meant to be. Why is it meant to be upright and erect? Because it contains nerves, and these nerves should be well protected, much like the shock absorber of your car. So if your car goes over a bump, you inside don't feel the bump. The shock absorber takes up the bump, so you are well protected. Just like that, the discs in your back are supposed to take the stresses and the loads onto them, so the nerve inside does not get affected by routine activity. Now, when we sit down, the normal shape of our back, which is curved out in the front, so our lower back is curved in a way that it's convex in the front, which means the center of gravity of the lower back is slightly offset behind, which means the discs in the front are loaded less. The minute we sit down, our pelvis moves forward intuitively. It has to happen because we sit down and we move the butt up. As soon as that happens, the spine loses its normal curvature, and the spine, from becoming convex in the front, becomes concave in the front, which effectively pushes the center of gravity forward now. And this causes a sustained excessive load on your disc. And your discs, which are supposed to resist deformation, they start getting deformed. It's much like if you have a nice new sofa set which is being used well, and suddenly you have kids jumping on it incessantly. The load on a healthy sofa has now gone up significantly, and the sofa starts deforming. This deformation is what we call degeneration, which in practical terms is dehydration. A dehydrated disc has now lost its shape memory, and hence now when you sit down, the bones start to collapse. Virtually, the spine loses its shape memory, starts to flop down, and this effect is far reaching. The effect of the spine collapsing or the spine telescoping or shortening when we sit down reaches the joints, the muscles, the ligaments, and sometimes the nerves. If you put in a needle electrode which measures pressure into the disc, you will see that the maximum pressure on the disc, short of bending and lifting, is when you sit down. So even when you run, the load on the disc is less compared to when you sit. Especially when you sit for longer hours, even the muscles get switched off. And so I'm trying to make this point loud and clear that long sitting is extremely harmful to our bodies. And we don't realize that because we are lost in work and we feel we are on an expensive, comfortable sofa. It doesn't matter what sofa or chair you're using. It's really the act of sitting for a long time that slowly loses the shape of your spine. So it's important. The lesson learned is that you got to make a concentrated effort, an unusual, unnatural effort of getting off the couch, walking around, at least for maybe arbitrarily for 5 minutes every hour, or maybe even every half an hour, or better still, look for different positions of work. So find yourself a tabletop where you can stand, or maybe a windowsill where you can stand by the windowsill and do a bit of your work. Find yourself a high chair like a bar stool or the back of a sofa, or walk during phone calls or walk during thinking hours, but scrupulously make an attempt to not sit for long. And merely by doing this, you'll be doing a lot of service. Now, finally, if you absolutely have to sit for long, like I have to sit right now through this talk, you ensure that you sit upright and sit active. The meaning of that is sitting is not a passive act. It's not like you plant yourself and the back collapses. You got to use your muscles to tone your body and your trunk up to take the load off the spine, and the load gets shared by the muscles. So sit upright, tuck your tummy in, sit tall, and then your back will not give you trouble. So that's as far as back pain and sitting, which is a default position in this lockdown, is concerned. What about neck? More and more people are calling in with neck pains, and the clear cut reason is what I'm doing now. It's either that I'm working on the laptop all the time. Invariably, the position of the laptop is not at my eye level, it's at a much lower level. So my head is stooping forward, trying to reach out, or I'm on my cell phone, and my cell phone is gets you down like this, because mostly this is how you use your cell phone. Now again, the neck, if you see from the side, is curved with its curvature forward. It's the same rule as the lower back. And the minute you start tilting your head forward, the function of your neck, incidentally, is to hold the 10-pound weight of your head. As you start moving forward, with every 30-degree tilt, the weight actually doubles. So the load on your neck will exponentially increase if you start stooping forward. And stooping forward, unfortunately, is again become a default position even before the lockdown happened, but more so during the lockdown, because you're sitting at home and working off screens. Apart from having a bad effect on the eyes and the head, there's a huge impact on the neck, and many of us come up with this really stiff, trapezius stiffness that we call, where the muscle which is supposed to hold your head up, the harness, starts getting stretched out of shape. And this causes you chronic neck pain and irritability, and sometimes back of the head pain, which can then go into some bad problems like pain going down the arm also, or numbness in the hands. So the lesson learned is that you want to try and keep all your activities at an eye level. So first sit down in a good position, and then get your works to suit your position, rather than you sitting and adapting yourself to the position where the work is. So sitting upright, one way of knowing how how you can manage a good posture is stand with your back to the wall. If you stand with your back to the wall, the back of your head, the shoulders, the butt, and the heel, they stack up in one line, and that's the right posture. Chin parallel to the floor and eyesight parallel to the floor, and get your work to suit that, and your neck will be fine. Asides of that, intermittently do reverse stretches. So stretch your muscles back, so this muscle gets a good good mobility, good stretch, and it remains active, doesn't start switching off its recruitment. Secondly, intermittently throw your head back and relax the neck, which means that if there's a phone call, don't talk like this. Try to throw your head back on the pillow so the weight is gone off the neck and your muscles get a good time to relax. So we spoke of low back problems increasing and neck problems increasing during this lockdown period. The causes are very elementary, and once you understand this basic cause, you're going to take very simple precautions to prevent this problem. But if you get this problem, how do you differentiate a red flag from a green flag? Which means that, do you need to rush in and call in to your spine surgeon each time or for every back or neck pain you get? So you need to know what are the red flags when you get these back pains. So typically the red flags are when the pain from the spine starts going down the extremity. So low back pain traveling down the buttock, thigh, or leg, or neck pain traveling down the shoulder, arm, and forearm. Both these are signs of the nerve getting involved, which is the last bastion in this process of overloading of the back. So when the back overloads, your joints, your discs, your muscles, your ligaments, they first give in, and finally the nerves start getting compressed. So if there is any pain that's traveling away from the epicenter but into the extremity, that's a red flag. Of course, if it's associated with tingling, numbness, or if the intensity of the pain is very severe, or the duration of pain has gone on beyond a couple of weeks, these are all conditions where you want to seek professional help rather than work on what we just discussed and make your own adjustments at home. There are some other reasons of pain during the lockdown, and one of the common ones which we see in our brethren is a newer form of exercise. So a lot of us now are tuned to doing regular exercises. I used to run outdoors, cycle outdoors, and all that got cramped up, and you can't keep a good man in for too long. So most of us are figuring out newer ways of trying to exercise. Personally, I started doing HIIT at home. Now these floor exercises, which you've never done before, they address a completely different set of muscles, and they are fairly high impact, and they're body weight exercise, and mostly our body weight is above 50 kilos. So you can imagine you've suddenly moved on from an exercise that you were you're comfortable doing for years on end into a very new form of exercise, which is good, but it's new for you. So it's important that you scale into these new exercises slowly, watchfully, keep vigilance on what's working for you and what's not. Be very vigilant of the form, and try to do these supervised rather than just off the rack. So they will not hurt you. The bang for buck of any new exercise has to be gained and gauged by the exerciser before he can tick the box and say that this works for me. Well, aside of this, guys, remember that keep your mobility going, because being in one place stalls up your muscles, makes your muscles short and cold. It clogs the venous blood in your legs, and there's no good venous return. It generally lowers your metabolism. So it's very, very easy for you to just spend about an hour walking in the corridor or in your room while you're working, and that also is good enough. Don't forget to breathe. So when you're not up and about, your breathing is very shallow, and you need to get that 500 ml of air in at one go to expand your lungs fully, so the lungs don't start stopping short of their capacity. So engage in deep breathing activities while you're seated, and watch what you're eating, because the last straw in this entire chain of, or a cascade of negative things that can happen sitting out of home, is gaining weight, because you're sitting here, you have no control on what food, because there's food all over, you're in your own palace. And you got to have long fasting hours between what you eat, so you don't gain weight. So a combination of inactivity, long sitting, bad posture, and overweight becomes the bugbear of a back and neck problem that emanates from this lockdown. So be aware of it, anticipate it, and be watchful. So that's the part on how the lockdown has actually affected people at large, and we're getting numerous calls on on the problem increasing and escalating. And simple advice normally helps you. Asides of this, we like to then ask you to do some basic exercises to tone up the muscles that actually go into the support of the back. And these are simple exercises to strengthen the abdominals, the obliques, the sides, and the back. So something like planks, oblique sit-ups, straight sit-ups, Superman's back extension, some simple stuff. But these are muscles that typically get ignored. Add to that vitamin D, because your exposure to sunlight has now got completely curtailed, and keeping your body weight down. So if you see the 4 pillars that are going to help you stay away from back pain, correct posture, exercises to service the muscles of the trunk, keeping your body weight down, and the right nutrients, including calcium, vitamin D, and protein. So keep that as your mantra and stay away from back problems. Quickly moving on to how this lockdown has actually affected me, or a spine surgeon practicing in the tertiary care city. Now, or tertiary care service. Now, I am a very busy spine surgeon. So my average would be 35 to 40 outpatients a day and 6 to 7 or even 10 surgeries a week. And this average has been consistently going on for over a decade now. And suddenly now I'm seeing about 20 patients a week and doing maybe 2 surgeries a week. Now, this downer is commensurate with what's going on around me, right? So this is a downer in the entire society. However, the requirement for spine services has really not gone down. So if your service has gone down or the availability of service has gone down, but the requirement stays the same, in fact, it's in some places gone up. How do you handle this problem? And so there is a new way of handling your clinics. And what most of us have done is significantly moved on to video consults. So one of the things that has changed in my practice is that I'm seeing half my patients on a video consult. Video consults come with many good hacks. For example, I have small clips of video recorded clips of some examination processes where I'm not physically examining the patient, but the video shows the patient's skin to do stuff that I would have done if the patient was in the clinic. So it's quite interactive, quite multi-dimensional, if you may. You can show pictures of certain activities. You can share with them some exercise videos. So there's lots of stuff that can go on. The big advantage is that this is done at the comfort of your home. So it respects the safety in a pandemic. It is done at a comfortable hour. It saves a lot of travel time for both the doctor and the patient, if you may. And you see the doctor face up without a mask. Today, it's very rare to see a person without a mask, and this is the only way that you're going to see the doctor face up with all the expressions. You can get to the person behind the face as you see the person and his expressions. So these are all the great advantages of video consults, and it's very, very efficiently running today in our system. There are some disadvantages, mind you, and I think one of them is the real physical examination. So in our practice as spine surgeons, there are about, I would say, 20% of cases that would have benefited if the surgeon had actually physically examined, touch feel examination of the patient. And here it becomes a game changer. So what we do is that if we figure that on a video consult, this person really needs to go that extra mile, we tell them, this is not working for you. You need to separate two major potential diagnosis. I need to really check you myself. So that's about 20% of cases. And the other is the touch feel of going to a clinic and seeing a doctor in totality. Understanding body language is gone away because you're now seeing a doctor in 2 dimensions on a flat screen for a limited time. So you got to be aware of that. But overall, most of us have taken the plunge into video consults. Even the older generation doctors are now quite happy to do video consults. Initially, it was a bit of an irritant, but now it's working well. We also have an assistant with us during the video consult who's recording what we say, so we don't miss out on anything, just like we did in the clinics. And they're clearly here to stay. Asides of that, we are doing short, specific clinics, which are outpatient clinics. And of course, like I said, they are working at 20%, which means I'm seeing 20 patients a week rather than actually less than 20%. The thing is that you got to see only the critical patients, and how do you then decide who's a critical patient? So it's very hard sitting on this side to decide or judge and say, you I need to see in the clinic and you can come on a video consult. So one of the filters we use is the patient himself. Patients today, or people at large, are quite well educated. They know, they've been to many doctors, they know where they stand, and they also don't want to risk going out, especially to a doctor's clinic. So they normally filter themselves out. If the problem is serious enough, they will make the trip and come and see you. And invariably, this turns out right. So if you now see the 20 or 30 patients that I see in a week, almost 25 of the 30 would be fairly critical patients, and they are the only ones who will actually land up at your clinic. The other change is that most of us are now not working out of hospitals. We are trying to see patients in private clinics where the environment is cleaner, if you may, compared to a hospital, which is also servicing patients who are suffering in the pandemic. Clinics have become smart clinics. In the olden days, you would like to go to a doctor's clinic which is full of patients and you're waiting there, reading magazines, watching TV, waiting for your turn to come. And that was the hallmark of a good doctor. Today, smart clinics means you walk into a clinic with a prior appointment, with nobody in the waiting area, and we give very filtered appointments, like 4 appointments in an hour or 3 appointments in an hour. So there's no cluttering in the clinic. There are, of course, the clinic is absolutely kept clean, no clutter, no magazines, no nothing. There is hand wash everywhere. The patient on phone before he takes the appointment or when he takes the appointment is asked about any history of fever. He's asked to come with a mask on. He's asked to come with the least number of attendants, maximum one attendant with him. And as soon as he walks in, the mask is checked. If he doesn't have a mask, the secretary gives the patient a mask. They're asked to clean up their hands. The doctor himself is normally in scrubs, which are changed out the minute he leaves the clinic. Most all of us are always masked, and we are disinfecting our hands time and again. We may or may not to use gloves, because the you can't. If you do, you may change it for every exam, but the same effect comes out of washing your hands. One of the primary reasons to wear gloves is that you resist the temptation of touching your face, because that's the only port of entry. So someone who's an asymptomatic carrier gets distanced off in this manner as much as possible. We try not to come close to the patients. In some clinics, there are plastic sheets that are kept between the doctor and the patient. We don't do that because we are in the business of treating back problems. We're not treating fever and cough. A lot of physicians who are far more exposed do that. Of course, the windows are kept open. Air condition is on because Bombay is at 35 degrees Celsius. So it's impossible to work without an air conditioner, but keep the AC and the windows on so there's good flow of air. Um, Make your consultation very short and very specific. There's no tender loving care. There's come se come. Do what is needed, get on it, and finish it off. As far as possible, do the follow ups on a video. And another thing that we have been indulging in is asking for reports on soft copies and giving out prescriptions on soft copies also. So less paper, less pens, less clutter. It's just one on one and out. What this has done is that it's taken away my fancy Rolex watch, my Mont Blanc pen, my Boss wallet out of the equation. You go in scrubs with nothing on you, go out in your in your home clothes with nothing on you, and that is what a new smart clinic is like. What about surgeries? The good news here is that surgeries have now come to a stage where only absolutely essential surgeries are done. Quality of life surgeries are being avoided. And by doing so, we are giving nature a chance to treat you, which is how it should be. So, somewhere down the medical system and the population lost that game and started demanding more and more treatment for less and less. That equation is being set right by this virus. Take it as you like it, but the fact is that that's happening. Before surgery, of course, COVID tests are essential, and hence the cost of surgery is slightly gone up because of the COVID test, all the PPEs that have to be worn. We are typically trying to operate in non-COVID hospitals, which makes it cleaner, because we don't do surgery for COVID. We do surgery for some other problem. The last thing we want is the patient going away, getting an infection from the hospital. Only relative emergencies are coming in. The moot point is pain, because pain is an emergency for the person who's suffering, but for the doctor, it's not an emergency. An emergency is when there's a neurological deficit. So again, we leave the filter with the patient. If he's unable to handle his pain and he's COVID negative, we go ahead and do the surgery. If he's COVID positive, it's not safe to do surgery because mortality and morbidity associated with any operation in the COVID positive person is significantly higher. Of course, the risk of surgery is higher in the surgeon, in the patient. So both of them consent for surgery after enough thought. Most of us who are, or most amongst our communities of surgeons who are above the age of 60 and people who have comorbidities like a cardiac or a diabetic situation have taken a sabbatical, and rightly so, because you don't want to risk treating quality of life illnesses and risking your own life. And finally, academic meetings and conferences have taken a completely different turn. Academic meetings are actually, we're teaching more and more because we have more time on hand. And we are conducting smart conferences. Sitting at home, you have the best speakers in the world talking to you about stuff that you wanted to always hear. So in that sense, it's a plus. Net, we are all working at 20% capacity, and we seem to have now tasted the benefits of a better lifestyle with a better work-life balance, much more time for self-improvement, introspection, academics, as well as for hobbies and for physical fitness. And on the other hand, like I said, we are giving nature a chance to show its capacity of curing people without the interference of doctors, if you may. And that's clearly an exciting change for the better for the humanity in general. So all in all, remember to sum up. Um, Remember to maintain good spine habits, less sitting, correct posture, frequent walks, no stooping of the neck, keeping your posture and your ergonomics correct. Take care of any new exercise that you do. Be vigilant. Do exercises for your trunk on a regular basis. Don't neglect it. Treat pains with common sense and patience, and remember the red flags, which will want you to seek professional advice on a video consult. Use medical services available to you diligently, optimally, and with due value. So finally, keep looking at the positives in this otherwise dreadful situation, and you will find your way. So thank you for this wonderful opportunity, therightdoctors.com, India's leading medical knowledge platform, and may you continue to do this service to all. Thank you again.
Insights from the world's best medical minds. You are watching therightdoctors.com.